Welcome back to this section on mental health in the series of holistic health. In the previous episode, we had seen the clinical features, the symptoms of major depression. In this episode, we shall entertain some questions regarding this important illness.
So, apart from the symptoms, like everybody cannot notice the symptoms. So, any pathological investigations are there through which we can detect these.
There are no pathological investigations, but there are psychological investigations.
Okay.
There are certain tests which a psychologist can conduct
Okay.
and detect these types of illnesses. But you cannot go to the laboratory and find out.
With any
whether-
of these tests, like
yes.
normal tests, you can't find.
Not yet developed.
Okay.
There are certain tests which are done for research purpose, where they are not able to measure these neurotransmitters, but they are able to measure the metabolites of these neurotransmitters present in the CSF, the cerebrospinal fluid.
Okay.
But that you cannot get it done from any ordinary lab.
Correct. It has to be.
So there is, like you said, in depression generally appetite goes down or person do not get sleep, there is
True.
insomnia. But can it happen because sometimes some people do complain that they feel sad, they don't feel like doing anything, but they eat a lot or sometimes they tend to sleep a lot.
True.
So can this...
Correct. So bulimia or hypersomnia, both symptoms can occur in depression, but they are less common compared to anorexia and insomnia.
So, what is the reason of hypochondria?
The person is more preoccupied with the well-being of the body.
Okay.
Treatable.
Their entire focus is on the
Depression.
physical body. They don't much bother about other issues in life.
Okay.
And they feel better only when they are sick.
Is depression treatable?
Of course, it is treatable.
So, is it for lifetime they have to take the medicine or just for a short period?
The average duration of one episode of depression is usually for 6 months. So, usually we give the treatment for 6 months.
6 months.
However, the range is very huge. It can last for as short as few minutes to few hours to few days to as long as several years. So, in the majority of the cases, it lasts for around 6 months. So, the treatment is given for that time.
So after 6 months, they did not take the medicine, or how?
After 6 months, 6 months of being totally asymptomatic on medication, we start gradually reducing the dose. If we find a relapse of any of the symptoms, then that's an indication that you have started reducing prematurely. So we restore the doses and again attempt to reduce after a few months.
Sir, apart from medicines, are there any other kind of treatment for depression or it's only medicine is the solution?
The medical treatment is the mainstay, but in certain cases of depression, which are refractory to any medicines you have given, so that you have given the medication for a long time in sufficient doses and yet there is no recovery, these are refractory cases, or in cases where the person is refusing to take medicines, or in cases where the suicidal tendency is very high and you cannot wait for the medicines to act, we resort to another form of treatment that is called ECT or electroconvulsive therapy, popularly known as shock treatment. Today there is a modified version of that called transcranial magnetic stimulation, TMS for short.
Is it safe, sir?
The ECTs are definitely safe, but they can only induce a remission, they cannot sustain the remission. So after the person feels better with it, again you have to resort to the medicines to keep up the improvement. Mind you, you can liken the depression to a fracture. When the person has a fracture of the legs, he cannot walk. But that doesn't mean that he has to lie down in bed. If he uses crutches, then in spite of the fracture, he is mobile. So the major depression, or for that matter, any mental illness, is like a fracture of the mind. And the medicines are like crutches. How long do you need the crutches?
Depends on
Till
Till
the
it heals.
fracture heals. But if you prematurely dispense with the crutches, what will happen? There will be a relapse.
And suppose a person is having a ailment already and they are depressed, like say Parkinson's and depression. So medicines can be given. Combined both the medicines, like for Parkinson's and
Yes.
so they are
No.
safe to be taken.
They can be taken. In fact, there are some medicines which will work both in
Both.
depression as well as Parkinsonism.
Okay.
So those would be preferred.
Doctor, this bipolar is a personality trait, right? It's
No,
a nature.
it's an illness.
Oh,
It's
a
not a
nature.
nature.
But it's not. Okay, so if depression is curable, then automatically that also.
No, I'll tell you. See, there are 3 types of mood swings. One is the cyclothymic personality about which we talked earlier. Second is the bipolar mood disorder, which is the illness. And the third are the mood swings that occur because of reaction to life events. Now, one has to learn to differentiate among these mood changes. In cyclothymic personality, the swings are natural and they come regularly at periodic intervals without any apparent reason in the situation. The treatment for that is self-control. Like say, when you are driving the car at 12 noon and wearing dark glasses, how will everything appear to you?
No,
Would you therefore put on the headlights? No.
no.
Why? Because though everything is appearing dark, you make a mental change. That though it appears dark to me, it actually not dark. The darkness is because of my
Yeah.
dark glasses. So your perception does not mislead your thinking and behavior. Similarly, the person with a cyclothymic personality should not be misled by his mood swings. In the hypomanic phase, he has to slow himself. In the melancholic phase, he has to push himself up. So there is more consistency. But this self-control is not going to work in bipolar mood disorder, which is because of neurotransmitter imbalance, and that is where we will need the medicines. In cyclothymic personality, there are no symptoms like lack of sleep or lack of appetite. In bipolar mood disorder, there are important symptoms. In the reactive mood swings or reactive emotional disturbances, we have to use psychotherapy to reorient yourself to life so that the emotional reactions do not occur. Because the management of all the 3 mood swings is different.
Are medicines addictive?
These medicines correct the neurotransmitter imbalance, right? The drugs of addictions are not required. In drugs of addictions, the person is taking them, consuming them for the kick that they get out of it. In these medicines, you're not getting a kick. You are being lifted from your low phase to a normal phase. However, when a person has a bipolar mood disorder, the person, after the depressive episode is over, may tend to go into the hypomanic phase. In which case, these medicines can push him up further. In fact, the appearance of the hypomanic symptoms while we are treating a depressive episode will indicate that this is the time for you to now start reducing the medicines, the antidepressant medicines. If after the medicines are also removed, the hypomanic symptoms persist, then it's not drug-induced hypomania, it is a fresh episode of hypomania, and that it is to be treated with medicines for the mania. So the drugs are a necessity for the time the illness lasts. However, if the person who enjoys the hypomanic episode wants to reach that, he can still do that with these antidepressant medicines. And he is using that not for treatment, but for induction of hypomania. In fact, from depression, most patients want to come out. Hypomania, the person doesn't want to come out, he is enjoying it. So, even when the person recovers from the depressive phase, if you ask the person, how do you feel? He says, not so good. Why? Because he's expecting to reach the hypomanic heights, which he considers mistakenly to be normal because he enjoys it. So, in such cases, the person may continue medicines beyond necessity, is abusing it. In addiction, the body gets dependent on the presence of the medicines, and if he stops that, there are withdrawal symptoms. These medicines do not have any withdrawal symptoms, so they are not drugs of addiction, but they can be abused by a person who is interested in bipolar.
And do these medicines increases one's weight, or that makes them dull?
True. These are some side effects of some of the medicines, some of the older medicines. Now, with research, newer medicines have been developed which are devoid of these side effects. Their only side effects that they are more costly, because whatever funds have been used for the research is recovered from the consumer. So, older medicines as effective, but they had these types of side effects.
And do these medicines cause any sleep? Like, are they like sleeping medicines?
No. Drowsiness can be a side effect of the medicine, but they are just not meant for sleep. Mind you, the sleeping medicine can only induce the sleep. They cannot remove the cause of the sleeplessness, which the antidepressants will do. So initially you may require some sleeping medicine for symptomatic relief, because these drugs take some time to act.
Okay.
So the person doesn't suffer from the symptoms. We do give these relieving medicines in the initial part of the treatment. Once the antidepressants take over and the cause of the insomnia has been controlled, then there is no need for this sleeping medicines.
So nowadays, a lot of, especially you find with the youngsters, like any kind of a doubt or they want to know something, they just go on Google and how, like, is it when it comes to depression and all that, is it right to do that? Like, form their own.
In Google, there is no quality check.
Mm.
Anybody can write anything that they want.
Mm.
And some of this can be misleading. They are more opinions rather than facts, which have been researched, well documented, well proven. And therefore, how much to rely on them is a questionable thing. In fact, one doctor had a notice in his clinic that your Google-based diagnosis and your Google-based treatment, 1,000 rupees. Your Google-based diagnosis, my treatment, 500 rupees. My diagnosis and my treatment, 200 rupees.
So many people feel such patients who have such kind of symptoms, they are dangerous to society and they can harm other people, and that's why they should not be allowed to remain in the society and they should be kept somewhere away from the society. So what do you have to say about it?
Yes, that would be protecting the other peoples in the society from the dangerous symptoms the person may have. But what about the well-being of the patient? Is it not the duty of the caretakers to remove this illness so that the person is not a danger to the society? In fact, let's say you're walking on the road and somebody kicks you and you get angry and you turn around to scold the person. And when you turn around, you find that the person is suffering from polio and has difficulty in walking. Now, will you get angry with that person?
No.
On the contrary, that anger will evaporate.
Yeah.
You will feel pity. And while you were ready to scold the person, now you don't scold, but you try to help the person. Similarly, whatever harm the person is doing is not intentionally, not deliberately. He is not capable of behaving otherwise. He is rather a victim of the disease, and our attitude has to be, rather than debar such a person from society, to help the person to integrate him back into the society.
So they can be treated and they can be brought back into the society.
Correct. Would you have the same attitude if your near and dear one was involved?
No, obviously.
So actually these patients are victims of their illness, and rather than getting annoyed with them, it is our duty to lend a helping hand.
So, doctor, you said your near and dear ones. Suppose if someone very close to you is having this depression, going through depression, and you don't realize, don't see the symptoms, or something. But like within a long term, like long time, like you also face, like you're living with the person. So is it contagious? Like you also the person is behaving in a particular way, but you don't realize what it is. Like both of you don't know whether it is depression, you're depressed or not. So how do you deal with that? And like both of you become patients, or how?
True. From what you are describing,
Hmm.
the relative seems to be suffering from major depression, but you are suffering from a reactive depression looking at this patient. So your treatment will be different and the other person's treatment would be different. However, if you and the relatives are sharing the same genetic pool, it is quite likely that both the siblings are suffering from the same illness. But rather than just assuming it, you have to prove it by eliciting the requisite symptoms.
Yeah. So, sir, what you said about the relative, it's same genetic pool is there, so it's possible that other person also going through it. But it is kind of a contagious, what people feel sometimes,
No.
that if you are staying with such kind of people, you will also become a patient one day. So is there any truth in that?
This is because they are not able to differentiate between reactive disturbances and the disease process. They consider the disease to be an extension of the disturbance, which is not the case. Yes, a few cases of severe disturbances can lead to diseases like, say, a brief reactive psychosis or a psychotic depressive reaction, but they are very few. The vast majority is because of the neurotransmitter imbalance brought about by the genetic makeup.
Sir, if a person is depressed, getting him or her married, will it cure his disease?
That is a very popular misconception in the society. Why depression? Any illness. They assume that it's because of lack of marriage, and that marriage will make everything okay. There is no debarment from marriage. However, legally, if you do not divulge this information to the opposite party, it can become a ground for divorce later on.
Okay.
So, it is very necessary that if the person is suffering from this illness, it should be revealed to the groom or the bride before the marriage.
Okay.
So bipolar and depression are correlated.
True. In major depression, the serotonin has gone down. When the same serotonin neurotransmitter goes up, it will lead to bipolar mood disorder or hypomania, which is the polar opposite of this illness. And the details of this we are going to see in the next episode.